My name is Anil Rustgi. I'm Chief of Gastroenterology at the University of Pennsylvania. My research and clinical interests are related to pancreatic cancer. From a research viewpoint, what are the processes and mechanisms that initiate pancreatic cancer and lead to its progression and spread? And from a clinical viewpoint, I see and evaluate patients and their family members who are at increased risk for pancreatic cancer. A question that I'm often asked relates to when is it important for me as a patient, as well as my family members, to seek genetic counseling. To that end, there are approximately 40,000 new cases of pancreatic cancer in the United States annually. Of these, up to 10% have some hereditary or familial basis with a strong penetrance, meaning that if there's a family history, it's likely to declare itself in that family. It's very important in this consideration to obtain details of one's family history about pancreatic cancer and even related cancers. That would be in parents, siblings, and children who are first-degree relatives, grandparents, uncles, aunts, first cousins who are second-degree relatives, and those beyond that would be third-degree relatives, and so forth. And it's very important to see if anyone had pancreatic cancer, to try to ascertain if that was the true diagnosis through surgical or endoscopic or pathology records, to see what age the diagnosis was, what the treatment was, and then extend that type of acquisition of analysis to all family members. So if one sees that there's a pattern of pancreatic cancer as well as other cancers in the family, if one sees that the age of onset of pancreatic cancer is early in life, especially roughly before the age of 60, because parenthetically, pancreatic cancer in the general population tends to occur in an average risk mode when when individuals are in their mid-60s to late 60s. So the combination of a family history plus early onset should trigger a concern that individuals in the family are at increased risk for pancreatic cancer, and one should seek out then through one's physician centers that specialize in the evaluation of family histories, genetic counseling, and the possibility of genetic testing.